Thank you so much for the opportunity. My name is José Belderbos. I'm a radiation oncologist at the Netherlands Cancer Institute. And we were very happy to present the results of local, regional, and pulmonary failures in the randomized PET-BOOST trial for non-small cell lung cancer. This was actually presented by Saskia Cook, who won Early Career Award. So very happy about that. As we all know, there's still a problem of intrathoracic recurrences after chemoradiation for stage 3 non-small cell lung cancer. And the PET-BOOST trial was a randomized phase 2 trial where 2 isotoxic dose escalation treatments were compared. One treatment was a homogeneous boost to the primary tumor as a whole, while the lymph nodes received a conventional dose, which means 66 gray in 24 fractions. And in the other arm, the patients were boosted on a sub-volume of the primary tumor, which was determined by the 50% sub-PET value. And in this randomized phase 2 trial, we looked at local recurrences. The goal of the phase 2 trial was to improve the freedom from local failure at 1 year from 70 to 85%. And in our trial, a total of 150 patients were included, of which 107 were randomized to the 2 arms. It was a pick the winner design. All patients had large volume stage 2 or 3 non-small cell lung cancer and were inoperable. And these patients had large volumes. The primary tumor had 100 cubic centimeter in the boost arm with a boost to the whole primary tumor, and 115 cubic centimeter in the sub-volume arm. And the dose per fraction was 3.3 gray for the patients that were randomized to the boost to the whole primary tumor, and 3.5 gray per fraction up to 84 gray in the arm which boosted the sub-volume. So these were quite high doses. And if we look at local and regional recurrences, actually for both arms, the goal was met, meaning that the local control was actually very good with only local failures of 11%. So we studied and we had central review of the CT scans of patients included in the trial, the site of first intrathoracic recurrence. And what we see is the incidence of local failure was very low. So we were happily surprised, and the summary of our randomized phase 2 trial, our dose escalation trial, to the whole primary tumor or the FDG subvolume in stage 2 and 3 non-small cell lung cancers with large tumors, that we have achieved excellent local control rates in both treatment arms with a 2-year local failure below 20% and regional failures of about 27%. So the main take-home message of our PET-BOOST trial is that dose escalation was highly effective in achieving local regional control. And this is certainly an area for further research. So dose escalation on the whole primary tumor or a subvolume leads to excellent local control rates. And we might hope that with boosting in a safe way, we might achieve local control rates similar to the high local control rates that we achieve in SBRT. Thank you so much for your attention.